My name's Amron Harper. I'm a medical liaison with Catalytic Health Partners. I've been with Catalytic for several months now, and it's the best job I've ever had.
Tell me a little bit about your role and responsibilities at CHP.
Yeah, so I'm a medical liaison, and so I do a lot of transitional care. I try to help our members if they go to the hospital, try to make sure that their time in the hospital, that things are being taken care of. I try to coordinate with the team to make sure that that happens. When they go home, there's going to be discharge instructions, medications that they need. Sometimes there's equipment that they need. So I try to take charge of ensuring that that takes place, that they get all the stuff that they need. Also, part of my role is as a medical educator. And so with that, oftentimes I'll have educational sessions. Some of our members have diabetes, and so we'll discuss diabetes, we'll discuss healthy diet and medications, how the medications work. It's not just diabetes, it's all through the spectrum of healthcare. And those are pretty much my roles, although in CHP we tend to wear lots of different hats. And so if a different need arises, that's not my primary concern, but it would just be best to take care of it in the moment, then oftentimes each of us will do that.
Very good. And what drew you to healthcare in the first place?
It's pretty cliche, but to help people, that's really it. I find it fulfilling to be able to help people, and that's just always kind of been something that's important to me to do, to spend my time like while I'm working doing something that I get fulfillment out of.
And the care you provide at CHP to the members, what's different than what you've done in the past?
Yeah, so it's really different. So with CHP, it's really, I think it's the philosophy behind it. And so the first thing that is really important to us is social needs. And the basis of that is that, for instance, we'll take the example of somebody who has diabetes and they take blood sugar medication. Medication is to control their blood sugar. If they don't have something to eat, if they don't have some safe place to stay, if they don't know how they're going to pay rent next week, all those things usually take precedence over regularly taking their blood sugar medications or regularly like seeking out proper diet. And so that oftentimes will come first, and that's just natural. Then next, oftentimes try to help with emotional needs, because if somebody's just struggling severely with anxiety or depression, or just, they're just not doing well, something's the matter. Again, blood sugar control often takes a back seat to that. And so what we do is we try to help people with what they really want and need help with first. And then once those needs are met, then we can try to help improve their lives with helping them manage their blood sugar or their blood pressure or the other things that aren't quite as pressing. So that's really different from where I've been in the past. Also, at CHP, the philosophy, we really genuinely care about our members. And that's one of the things, they're members of our of our organization, or they're our members, they're not patients. Also, there's no judgment, which I really like. It's not something that I knew was that important before CHP, but since I've started working, I realize how important it is in healthcare. There is no judgment. In other words, like, some of our members, make choices that I wouldn't necessarily make, but the only way we can help them is by designing, their care plan around what it is that they want to do and how they want to, to pursue their healthcare goals. So we have to work within that frame, and that's also different. It's not just like, oh, this is the expectation, you need to do this. So I really like those things about CHP.
That's awesome. You talked about making a difference and improving or saving, changing a life. Can you share with us an experience that you had in making a difference, or how you improved an outcome or enlightened a member about a better way how to achieve their goals?
Yeah. So, so we had a member who was struggling, and it's really simple, but they were struggling to understand what their medications were for. And because they didn't understand what the medication was for, they didn't take it all the time. They didn't understand why. And so it was really simple. It was something that most could do, just kind of helped understand the why, what the medication actually did in their body. And that made a big difference for them. And so that was really it was just a good experience for me, because I got to be part of them better managing, and it was their blood pressure in that case. They understood why they were taking that medication, what the medication was doing, and so they started taking it. And that just made me feel good, because simple, but it was life-changing for them.
Fantastic. Tell me a little bit about tell me one thing that you wish everybody knew about Catalytic Health Partners.
I think it's the no. I think it's two things. Can I do that? It's the no judgment, and it's the actually caring about our members. Because I've seen it time and time again how it really makes such a big difference. People actually have the desire to change some of the things that they're doing. They realize that there's somebody who cares about them and who's not just judging them. And so that brings about change in them. And that's something that we try to embody, and it starts at the top. That's how my orientation was. That's how we are, and that's our philosophy.
Very good. Can you tell me a little bit about how you use technology in your role?
Yeah. So that's really neat about Catalytic. So we use tablets. All of our members have tablets, and the tablets are connected through the cell service. So they always have internet, right? And then the tablets are also connected. So with those tablets, our members have a way to always connect to us. They can always talk to us through the tablet. Oftentimes it's a video conference that they can have with a member here in the office. Another way this is what I actually really, really like about what we do, is we have devices like a glucometer, which measures blood glucose, and blood pressure cuffs, so that our members can check their blood pressure, and it's like an automatic one. They just press a button, and they can check their glucose levels, and then those results automatically transmit through Bluetooth to their tablet. Because their tablet's connected to the internet, we have the results. And so part of what my job as a medical liaison is, I go through we call it telemonitoring. I go through the telemonitoring results for the blood pressure and the glucose and some others results daily, multiple times a day, and we can see where our members are. And so oftentimes I'll see that one of our members' blood sugar has dropped through the night. For instance, I had a member who in the past week, twice in the middle of the night, their blood sugar was really, really low. And so I could contact them. I could send them a text, just ask them how they're doing, or I could call them. The second time I sent a text, the first time I called. And she was doing okay. But it meant a lot to her that somebody was actually looking. And so we find that the fact that they know somebody's paying attention gives them more incentive to check often. And then they're seeing better their own results, how the medications are affecting, how their diet's affecting them. And so I think it really helps. Another thing that we do, and we're encouraged to do, again, since orientation, is that when our members are doing a good job, and we're checking, and we see, because we have 3 months of results on the computer, and we see improvement in the results, to go ahead and congratulate our members, and that makes a big difference to them. And that's really fun, because you get to call them and you get to tell them, or when you see them, you get to tell them, like, hey, we noticed you're doing a really good job. And then they genuinely express, they genuinely express that feels really good to them. So that's the it's fun. It's good.
That is really good. What do you think you've learned about yourself by working with members?
A lot. And since just starting with Catalytic. So one of the trainings that we did was about motivational interviewing. And motivational interviewing, one of the key parts of it is that the healthcare provider, when they're talking to a patient or a member, it's not about the healthcare provider. It really is all about our members. And so what I learned was oftentimes before that training, before dealing with our members, oftentimes without meaning to, I would make it about me. And if somebody didn't make they just didn't take their medication or whatever it was, I made it about me. And really it's about our members. And if they're not doing it, it's because there's, maybe they don't understand why or whatever. And if it's about them, then we're genuinely concerned about them. And we find out a way that we can actually help. So I really like that. That's one of the things, yeah.
That's really good. What one thing should people know about you?
I don't know. One thing that people should know about me. I don't know.
Outside of your work.
Outside of work?
Just one thing that maybe would surprise people to know about you.
I have 5 kids. I care a lot about my family. That's like my number one thing. Yeah, that I have a family and they're the most important to me.
That's great. That probably comes across in your work.
Yeah. Oftentimes we'll share, I'll share a picture because I'm just a proud dad, so I'll share pictures of my family. I think that makes better connection with our members too.
I think so too. 2 more questions. Can you tell me what health plans should know about the work that you do?
About Catalytic. That we genuinely care. We really, really do care about our members. And that comes across in everything that we do. It's not about numbers. It's not about any of that. That we really, really care about our members and improving their lives. And because we do that, we get really, really good results. But the results they're just a bonus. They always come. It's that whole thing about, I don't know, I like to listen to podcasts. And so I've heard several successful entrepreneurs when they talk about what they've done, and they talk about it's not about the money. The money comes when you passionately do something and you work really hard, but you're working really hard because you care and because you're passionate about it. And the money is just a byproduct. But when you make it about the money, then that changes it all, and it doesn't. So that's it. And it's the same in healthcare, that if we're really genuinely caring about these people, then we're going to be doing things to really help them. And they're really going to feel that and really make difference. It just makes a big difference in the outcome of their care.
It's huge.
Yeah.
So if you were to be a superhero, who would it be?
If I were to be a superhero? That's a hard one. I guess Superman, just because he's he can do it all. Or Batman, because he doesn't actually have any superpowers and he just works really hard. No.